Hello, my name is Michelle Yeatts. I'm a student at the University of Texas at Arlington's Nursing 5309. Today I'm going to be presenting a project on innovative learning strategies. So today I'm going to be introducing games, and the purpose of this game is to help prepare staff nurses for a magnet designation site visit. Magnet designation is an award given by the American Nursing Credentialing Center to healthcare organizations who have quality patient care, nursing excellence, and innovations in nursing practice. So today we'll be preparing staff nurses by playing a game called the Magnet Wheel. So here's our magnet wheel, and it is loaded with points to give the employees. When they spin an answer correctly, they get the points, and these points can be used to buy gift cards, spa days, and movie tickets. It's a great way for us to reward our staff members for going above and beyond. So let's go ahead and head into our surgical unit. April.
Hi.
Hi, I was wondering if you wanted to test your magnet knowledge.
Yeah, I would love to.
Great, come on over. So this is our magnet wheel loaded with points that you can earn by answering the questions correctly.
Okay.
So the way we'll play is you'll spin, I'll ask a question. Once you answer it right, then we'll spin again. We'll do this until you get the question wrong.
Okay.
All right, perfect. April, thank you for participating.
All right,
You got to spin the wheel.
Okay.
All right, 200 points. So the question is what is one way the professional practice model guides your practice as a nurse?
Well, one of the main things about our professional practice model is synergy. So that means putting together patient needs with nursing competencies. For example, I'm the charge nurse on my unit, and this morning I used our professional practice model to attach our nursing competencies with our patient needs.
Perfect. Great. That's an excellent way to combine the practice model that we use in our everyday world. So go ahead and spin again.
Okay.
Ooh, bonus. That's 500 points.
All right.
If you can get this one right. So discuss your role in the magnet designation process.
Well, I'm on my unit's practice council, and that's a great way for our voices to be heard and nurses, and also for us to come up with new ways, new knowledge, and innovation to use in our current practice. For example, on our surgical unit, we have a high risk for patients falling, so we came up with a new tool, and after we implemented that fall risk tool, then we collected data to see how we were doing.
Wow, that's great. That's an example of how Magnet can make our hospitals a better place. So did your tool work?
It did. We saw huge improvements.
Wow, that's great. And it's nice to see those numbers to back that up.
It is.
Perfect. Go ahead and spin again.
Okay.
Another bonus.
All
That's
right.
500 more points. All right, so describe one way that you were involved in implementing the hospital's strategic initiatives.
Well, one of our main goals this year is to increase our nursing certification rate. So I'm currently working on my certification in med-surg nursing.
Okay, perfect. Well, when do you take the test?
I have it in 2 weeks.
2 weeks. Wow, that's really exciting. That's a great tangible way to show everybody, your patients and your coworkers, that you really are an expert in your clinical practice. That's perfect, April. Go ahead and spin the wheel again.
Okay.
300 points. All right. So what is the difference between process improvement, evidence-based practice, and nursing research?
Well, I'm not sure if I know the differences, but I do know that evidence-based practice is using research to create a positive change in our current practice. For example, if I read an article that had a positive impact on our patients, I could use that, and it might end up changing our current policies or procedures.
That's great. Do you know anything about process improvement or nursing research?
Not really.
Okay, well, I'd be happy to tell you. So process improvement is just increasing efficiency and effectiveness. And the nursing research is an investigation of new knowledge. Here is a brochure from our Evidence-Based Practice and Research Council. We meet once a month, every Friday, the last Friday of the month, from 11 to noon, and we'd love to have you there to learn more about our projects that we currently have going on.
Okay.
All right, perfect. April, do you feel like we're magnet ready?
I do. I feel like we are.
All right. Did this help that we were able to come around and test your knowledge?
I do. I feel better about Magnet and getting ready for our next designation.
Good. So when the site visitors come, we want you to be energetic and excited and ready to answer these questions.
All right. Well, we're ready.
All right. Perfect. So this is a great way that we demonstrated how games were able to invoke and get staff engaged in our Magnet designation process. Thank you so much, and